Friends, hi, we are doing post-operative rounds for our patient who has come to us from Nepal. This is a lady who has been detected to have low rectal endometriosis. Low rectal endometriosis means from the anal opening, the place where we pass stools, the distance of the endometriotic lesion is less than 7 to 8 centimeters. Now remember, these are very critical patients. You have to operate them very meticulously, because when we do surgery, you would have seen we are using staplers. We have shown it so many times on Facebook, Instagram, everywhere. These staplers find a very difficult angle to go down such deep at the level of the lower rectum. That is one thing. Second, if the surgery is done correctly, then just like her, in 24 hours the patients will recover. Believe me, her recovery is so good that we are going to be discharging her today and she's going to go back to Nepal. Another important thing. Many women are worried whenever we mention about low rectal endometriosis. They are worried that, okay, in this situation, are you going to put a colostomy? Are you going to put an ileostomy? So as a patient, they only know that the intestine will be got out in the form of a stoma bag. And that is the fear. Many people who don't operate on their own are going to give you this negative counseling also. That no, bag lag jayega and all these types of things. Remember friends, on an average, we do close to 2,500 to 3,000 such surgeries for endometriosis every year. And every year, less than one patient ends up with a diversion. Usually the diversion is recommended when the patient we are repairing for an infected case like a fistula or something else. But that is beyond the scope of discussion. I want you to be mentally ready that if you go to an expert, such type of things are not going to happen to you. Right? Now, what are the instructions that we need to give her, because she's traveling all the way to Nepal? So we have to give her some instructions. What type of food she should eat? Shall she walk? Shall she lift weights? These are common questions of patients. She can lift whatever weight she wants to lift. She can lift her own bag, put it on the conveyor belt and sit in the aircraft and go back. No problem. For the next 5 to 6 days, we just want her to eat a heavy liquid diet. Heavy liquid diet in Indian language is dal khichdi. Understanding? It is any heavy types of soups, milkshakes, juices, all these things. Why did I mention this? The reason is because the anastomosis is so low down that I want stools to be soft. That is very important for me. Stools have to be very soft till there is complete healing. See, remember, when we use staplers, the healing occurs in 3 layers. So that is itself very strong, but still, it is a freshly operated part. It is better to be slightly more careful. Remember, long term, in this situation, patient faces no consequences. Disease recurrence, 0%, because the entire disease has been removed completely for the patient. One more important point which we should mention, because it is a low rectal endometriosis, many a times the nerves which are present there do get dissected. Because these nerves get dissected, some patients, like let's say out of 100, one patient will end up with something called as post-operative urine retention. That means they will not be able to pass urine easily. That can happen. Fortunately, nothing like that has happened to her. She is absolutely fine. She is going home. This is the recovery which will happen when patients usually come to referral units or expert units to get their surgeries done. That is the reason why it is recommended in endometriosis, go to a specialist. If you don't go to a specialist, that's also okay. At least get operated from somebody who is genuinely a specialist.